If you are over 60 and still masturbating the same way you did decades ago, I need you to hear this clearly. You may be quietly damaging your body every single time you do it. Not because masturbation is wrong, but because after 60, your body no longer tolerates the same habits. I've seen men lose sensitivity, develop prostate irritation, and struggle with erections, not from disease, but from one simple mistake they repeated for years without realizing harm. This is why the message is so direct. Never do this while masturbating after 60. My name is Dr. Mohit Kara. I'm a board-certified urologist, and for more than 30 years, I've dedicated my career to men's sexual and prostate health. I've treated thousands of men in their 60s, 70s, and beyond. Strong, intelligent men who assumed their bodies would age the same way if they just kept doing what once worked. Medicine doesn't support that assumption, and neither does experience. Here's the paradox that confuses so many older men. Masturbation can support circulation, prostate health, and nerve function, or it can quietly undermine all three. The difference isn't how often you do it, it's how you do it. Small technical mistakes repeated over time change how the nervous system, blood vessels, and pelvic muscles respond, and most men have never been taught this. In this video, I'm going to explain 7 masturbation mistakes men over 60 commonly make that silently harm their prostate, reduce sensitivity, and weaken sexual function, and I'll show you exactly how to correct them safely and naturally. This isn't about fear, it's about protecting your body and your dignity. And stay with me because one of these mistakes sounds completely harmless, almost also logical, yet it causes more long-term damage than aging itself. Before we continue, I want to make sure you stay informed and protected. If you haven't subscribed yet, take a moment to do so and turn on notifications. I share clear, science-based guidance created specifically for men over 60. If this topic speaks to you, type 1 in the comments. If it doesn't, type 0 and tell me what you need. Now, let's begin with the first mistake most men don't realize they're making. Mistake number 1. Using pornography as your primary stimulation after 60. This is one of the hardest conversations I have with older men because it's deeply personal and often wrapped in shame and silence. Many men lower their voices when they bring it up. Some won't even say the word. They'll look at me and say, "Doctor, I just don't feel the same anymore. Nothing excites me like it used to." They assume their desire is fading because of age, but in many cases, age isn't the real cause. What's actually happening is neurological overload. After 60, your brain changes. Your dopamine system, which is responsible for pleasure, motivation, and arousal, becomes more sensitive to overstimulation and slower to recover. This is normal biology, not weakness. The problem is that modern pornography is designed to deliver constant novelty at a pace your aging nervous system can no longer tolerate. Every new image, every sudden change, every exaggerated stimulus forces your brain to release dopamine faster than it can replenish it. Over time, the brain adapts by turning the volume down. This is why real touch begins to feel muted, why intimacy feels less engaging, why you may need more intense or extreme content just to feel a response, and eventually, even that stops working the way it used to. What concerns me most isn't just the loss of arousal, it's the emotional disconnect that quietly follows. Men begin to feel detached from their own bodies, from their partners, and from pleasure itself. They don't feel broken enough to seek help, but they don't feel alive either.
I want you to understand something important. This is not a moral issue. It's not about willpower or discipline. It's about giving your nervous system the environment it needs to function well at this stage of life. Constant visual stimulation prevents your brain from rediscovering a slower, deeper, more physical form of arousal, the kind that supports circulation, nerve health, and emotional satisfaction. When men reduce or step away from porn, especially for a short reset period, something remarkable often happens. Sensation gradually returns. Arousal becomes more responsive to touch. Confidence improves. Pleasure feels earned instead of chased. I've watched men in their 70s rediscover sensations they thought were gone forever, not because they added something new, but because they removed what was overwhelming their system. Your body after 60 doesn't need more stimulation. It needs better stimulation. And once you understand that, it opens the door to the next mistake, one that almost every man has done for convenience, never realizing that where you masturbate may be quietly harming your circulation and prostate health without you ever feeling a thing at first. Mistake number 2, masturbating while sitting on the toilet. This is a habit many men mention almost casually, often followed by a nervous laugh as if it's something too small to matter. "It's just convenient, doctor," they tell me. "It's private, it's quick." And I understand that reasoning. Over the years, bathrooms become one of the few places where older men feel they won't be interrupted. But what feels practical in the moment can quietly work against your body over time. When you sit on a toilet, especially if you lean forward, your pelvis is placed in a position it was never designed to hold for prolonged periods during sexual stimulation. The hard surface beneath you presses directly into the muscles, nerves, and blood vessels that supply the prostate and genitals. In younger men, the body can often compensate. After 60, it has far less margin for error. I've had patients come to me with complaints that seem unrelated at first. A weaker urinary stream, a dull ache in the groin that comes and goes, erections that feel less full, even though desire is still present. Many of them are surprised when we trace the pattern back to habits like this. Restricted blood flow repeated over months or years leads to chronic pelvic tension. Nerves become less responsive. Circulation doesn't fully rebound, especially when stimulation is paired with compression instead of relaxation. There's also a psychological component most men don't expect. When masturbation is rushed in an uncomfortable position, the nervous system remains in a guarded state. The body never fully relaxes into the experience. Over time, this trains your brain to associate arousal with tension instead of release. That subtle shift contributes to fatigue after climax instead of restoration, a complaint I hear far more often from men in their 60s than anything else. The solution isn't complicated, but it does require awareness. Your pelvic region needs space and support, especially during arousal. Positions that allow your body to open rather than fold forward encourage better circulation and nerve signaling. Reclining, lying down, or standing upright allows blood to move freely and muscles to soften instead of tighten. These small adjustments protect the structures that matter most for urinary and sexual health. Your body gives fewer warnings as you age. By the time discomfort appears, changes have often been happening for years. That's why habits like this deserve attention now, not later, because once you correct where and how your body is positioned, you'll begin to notice something important. The quality of sensation changes, and that leads directly into the next mistake, one nearly every man rushes through without knowing he's training his nervous system to shut down when it should be restoring strength and pleasure instead. Mistake number 3, rushing through the experience. This mistake doesn't look dangerous on the surface. In fact, many men see it as practical. They tell me they're just trying to be efficient. Life is busy, energy isn't what it used to, so they rush. A few minutes, minimal thought, no real attention to what the body is doing. What most men don't realize is that this habit slowly retrains the nervous system in a way that works directly against sexual health after 60.
When you rush, your body doesn't recognize the moment as restorative. It recognizes it as something to get through. Heart rate increases, muscles tighten, blood vessels constrict slightly instead of opening. This is a mild stress response, not full panic, but enough to matter over time. The hormones released during hurried stimulation are very different from those released during relaxed, mindful arousal. Instead of oxytocin and a sense of calm, the body leans toward adrenaline and cortisol. I've had many older men describe the same strange feeling. They still climax, but afterward they feel drained, flat, or even irritable. There's no sense of satisfaction, no emotional relief. They assume this is simply what aging feels like, but again, aging is often blamed for something that is actually about process. The nervous system after 60 needs more time, not less, to shift into a state where healing and pleasure occur together. Rushing also dulls sensation at the brain level. When stimulation is fast and goal-oriented, the brain focuses only on finishing. Subtle sensations never register. Over years, this narrows your range of pleasure. Men begin to feel less connected to touch, less responsive to slower arousal, and more dependent on speed to reach climax. That dependence becomes a problem when sensitivity naturally changes with age. Slowing down is not about indulgence. It's about alignment with how your body works. Gentle, sustained stimulation allows blood flow to improve gradually. The parasympathetic nervous system engages, breathing deepens, muscles soften. This is the state where the body repairs itself instead of depleting itself. Many men tell me they're surprised by how unfamiliar this feels at first. Not because it's wrong, but because they've been rushing for so long they forgot what calm arousal feels like. There's also something emotionally important that happens when you slow down. Pleasure stops feeling like a task. It becomes something you can receive rather than force. That shift alone can restore interest and confidence in men who felt they were simply losing desire. In reality, their bodies were just asking for permission to take their time. Once a man understands this, he often starts noticing another issue, a muscle group he has unknowingly been tensing or misusing during rushed arousal for years, quietly weakening the very foundation that supports erections, bladder control, and sexual stability after 60. Mistake number 4, ignoring the pelvic floor muscles. Most men go their entire lives without ever being taught that they even have a pelvic floor. It's not talked about, it's not visible, and until something goes wrong, it's completely ignored. Yet this small group of muscles quietly support some of the most important functions in your body: urination, erection quality, ejaculation control, and the stability of the prostate itself. By the time men reach their 60s, the condition of these muscles matters more than ever. I often see men who are confused by what their bodies are doing.
They notice subtle leaks when they cough or stand up too quickly. Erections don't feel as firm even when desire is present. Sensation seems delayed or inconsistent. They assume these changes are unavoidable parts of getting older. But when I ask a few simple questions about habits and muscle awareness, the pattern becomes clear. Many men have spent decades pushing, straining, or holding tension during arousal without realizing the long-term effect. During masturbation, especially when rushed, it's common for men to bear down slightly, almost as if assisting the body toward climax. This reflex feels natural, but over time it weakens the pelvic floor rather than engaging it. Imagine relying on a muscle for decades without ever exercising it correctly. Gradually, it loses tone, blood flow becomes less efficient, nerve signaling weakens. The result shows up years later as reduced control and confidence. What many men find surprising is how quickly awareness alone begins to change things. When you learn to gently engage the pelvic floor, the same muscles you would use to stop urination midstream, you bring circulation and nerve activity back to a region that has been underused and overstressed. Holding that contraction briefly, then releasing it fully, teaches the muscles to support arousal instead of resisting it. Over time, this improves erection quality and helps restore a sense of control many men thought was lost. There is also a psychological shift that happens when these muscles awaken. Men often describe feeling more grounded, more present in their bodies. Confidence improves not because something external changed, but because they feel supported from within. That foundation matters. A strong pelvic floor doesn't just improve performance, it reduces anxiety around performance, which is just as important after 60. I want to be clear, this isn't about force or strain. Overworking these muscles can be just as harmful as ignoring them. The goal is coordination, not effort. Gentle engagement followed by full relaxation teaches your body how to work with you instead of against you. Many of the men I treat say this is the first time they've ever felt truly connected to that part of their body. Once a man understands how much the pelvic floor influences sensation and control, he often starts questioning another habit, how often he masturbates, and whether that rhythm is actually supporting his prostate and energy levels, or quietly pushing his body too far in either direction. Mistake number 5, getting frequency completely wrong. This is one of the most common questions men ask me, usually in a quiet voice, after they've built up the courage to bring up the topic at all. Doctor, am I doing it too often? Or just as frequently, am I not doing it enough anymore? What they're really asking is whether their body is still normal, whether they're helping themselves or slowly causing harm. The truth is, after 60, frequency matters far more than most men realize, and getting it wrong in either direction can quietly affect both the prostate and overall vitality. Some men masturbate frequently out of habit rather than desire. It becomes routine, almost automatic. They assume more is better, that regular release must be healthy. But the body after 60 doesn't rebound the same way it once did. Too much stimulation without adequate recovery can leave the prostate irritated and inflamed. Testosterone levels don't fully rebuild, energy feels lower, motivation dips, and pleasure becomes flat instead of renewing. These men often tell me they feel tired afterward, not relaxed, a sign the body is being depleted rather than supported.
On the other end of the spectrum are men who go long periods without any sexual stimulation at all. Sometimes this comes from fear, sometimes from diminished desire, sometimes from the belief that abstinence protects the body. But complete inactivity creates its own problems. Circulation slows, nerve pathways receive less stimulation, and tissue can lose elasticity over time. The pelvic region thrives on healthy blood flow, and long gaps without stimulation can make arousal feel more difficult or distant when it does return. What complicates this issue is that there is no single number that applies to every man. Health, stress, medication, sleep, and emotional state all influence what feels right. However, in my clinical experience, many men over 60 benefit from moderation, not extremes, a rhythm that is intentional rather than compulsive, regular enough to support circulation and prostate health, but spaced enough to allow hormones and energy to rebuild. When masturbation happens with awareness at a pace that respects recovery, men often report better erections, clearer desire, and a sense of balance rather than urgency. Pleasure feels meaningful again, not draining. This is when masturbation supports health instead of masking deeper fatigue. The goal is not to follow a rule, but to listen closely to your body's response before and after. Your body does speak. Fatigue, irritability, and loss of interest are its warnings. Many men are surprised by how much restoring balance here improves their confidence. When frequency aligns with the body's needs, anxiety diminishes. There's no constant questioning of whether something is wrong. Instead, there's trust in the body and in oneself. That trust becomes increasingly important with age. But even when frequency is correct, there is still a mistake that can undo all of these benefits. One instinctive habit often used to compensate for changing sensitivity that over time causes more damage than men ever expect, and it's the next one we need to talk about. Mistake number 6, applying too much pressure or force. This is the mistake I see cause the most long-term damage, and it almost always begins with good intentions. As men age, sensitivity naturally changes. What used to feel effortless now takes longer.
So many men respond instinctively. They grip harder, press more firmly, or use rougher stimulation, believing they're helping their body respond. I want to be very clear here. This instinct is understandable, but it is also dangerous. The nerves in the penis are extremely delicate, especially after 60. They are designed to respond to warmth, rhythm, and gentle pressure, not force. When excessive pressure is repeated over time, it creates microscopic injuries to nerve endings and surrounding tissue. These injuries don't cause sharp pain, so they often go unnoticed. Instead, the damage shows up slowly as reduced sensation, delayed arousal, or erections that feel less responsive and less alive. I've had men sit across from me and say, "Doctor, it just doesn't feel the same anymore." They assume their nerves are dying. They assume aging has taken something away permanently. But when we look closely, the issue is often mechanical trauma, years of overstimulation done in a way the tissue cannot tolerate indefinitely. Scar tissue begins to form, elasticity decreases. In some cases, men even develop penile curvature or discomfort that affects confidence and intimacy. There's also an emotional pattern that develops alongside this physical damage. Pleasure becomes something to extract rather than experience. Men stop listening to their bodies and start overpowering them. That mindset alone blocks the very blood flow and hormonal response needed for satisfying arousal. Instead of relaxation, the body braces. Instead of fullness, it tightens. Over time, this creates a cycle where more force is needed for less sensation, further accelerating the problem. What restores function is counterintuitive but powerful. Gentleness, slower movements, lighter pressure, giving your nervous system time to respond instead of demanding results. Men often tell me this feels unfamiliar at first, almost uncomfortable, because it requires patience. But when they persist, sensation begins to return, not suddenly, but gradually and naturally. As nerves relearn that stimulation is safe rather than overwhelming, your body responds best to care, not aggression. Think of how you would want someone else to touch you, with attention, softness, and respect. That same standard applies here. This shift alone can preserve sensation far longer than any supplement or medication ever could. And once a man stops forcing his body and starts listening to it again, he often realizes there's one final issue he's overlooked. Not physical, but emotional. A missing element that determines whether masturbation leaves him feeling restored or quietly empty afterward.
Mistake number 7, masturbating without emotional connection or intention. This is the mistake that's hardest to measure because it doesn't show up on a lab test or an exam. Yet, I believe it affects more men after 60 than any of the others. Over time, masturbation can become automatic, something done out of habit, boredom, or loneliness, rather than genuine desire. When that happens, the body still goes through the motions, but the deeper systems that create restoration and emotional satisfaction remain quiet. I've listened to men describe this feeling in different ways. Some say they feel surprisingly empty afterward. Others tell me they finish and immediately feel tired or disconnected, as if something was taken from them instead of returned. They don't talk about this openly because it feels confusing and personal. Many assume this hollow feeling is just another sign of aging, but it isn't. It's a signal that the emotional component of arousal has been removed. From a medical perspective, this matters more than most people realize. When masturbation lacks presence and intention, the hormones associated with bonding, relaxation, and well-being are barely released. Oxytocin stays low, dopamine doesn't restore motivation, and the nervous system doesn't shift into a healing state. Instead of feeling grounded, the body remains neutral or even slightly stressed. Over time, this creates a pattern where pleasure no longer nourishes the mind or the body. I often tell my patients that self-pleasure doesn't have to be mindless to be healthy. Even when you are alone, the body responds powerfully to attention and respect. When men approach the experience with awareness, slowing their breathing, noticing sensation, appreciating that their body can still respond, something changes. It becomes less about release and more about connection. This is where many men rediscover a sense of calm and satisfaction they thought was gone forever. There is also dignity in this approach. After 60, many men struggle quietly with feeling invisible or less connected to their bodies. Bringing intention back into this moment restores a sense of ownership and respect for oneself. It reminds the body that pleasure is not something to chase or escape into, but something that can be received fully and without shame. When masturbation includes emotional presence, it works with the nervous system instead of bypassing it. Men often describe sleeping better, feeling more relaxed afterward, and carrying a subtle sense of well-being into the next day. These are not small benefits. They affect how you move through life. Now, here's what most men don't expect. When you correct these 7 mistakes together, the body begins to respond in a way that goes far beyond masturbation itself, and that leads us into a final bonus insight. One simple mindset shift that can accelerate every improvement you've just learned and help your sexual health continue to strengthen long after this video ends. Mistake number 8, treating aging as decline instead of adaptation. This may not sound like a mistake in the traditional sense, but in my experience, it is one of the most damaging beliefs older men carry into this stage of life. Many men assume that everything related to sexuality after 60 is a slow downhill path, weaker erections, less desire, less satisfaction, so when changes appear, they stop listening to their bodies and start surrendering to assumptions. They tell themselves, this is just how it is now, and they adjust their expectations downward instead of adjusting their approach. I've had countless men say to me almost apologetically, "Doctor, I know I'm getting older, so I can't expect much anymore." And every time I hear that, I know we are dealing with mindset before medicine. Aging does change the body, but change does not automatically mean loss. More often, it means the body is asking for different inputs, different timing, different pacing, and different care. When men treat aging as decline, they disconnect from curiosity. They stop experimenting gently, they stop paying attention to subtle feedback. Sexual activity, including masturbation, becomes mechanical or resigned instead of responsive. This mindset quietly strips pleasure of its vitality. The nervous system responds to expectation, and when expectation is low, response weakens accordingly. What I want men to understand is this. The body after 60 is not fragile, but it is precise. It rewards awareness, it responds to respect. Small corrections in how you touch, how you breathe, how you pace yourself often generate outsized improvements, but those improvements only happen when a man believes his body is still capable of response. Hope in this context is not emotional fluff, it is physiological. Optimism changes engagement, and engagement changes outcome. I've seen men in their 70s regain sensitivity, confidence, and enjoyment, not because they fought aging, but because they cooperated with it. They stopped forcing their bodies to behave like they were 40 and started listening to what 65 or 70 was actually asking for. That shift alone reduces anxiety, which is one of the greatest inhibitors of sexual function in older men. When you approach your body as something still learning, still adapting, everything changes. Masturbation becomes exploration instead of repetition. Sensation feels more nuanced. Satisfaction becomes quieter but deeper. And importantly, men stop judging themselves harshly for changes instead of working with them. This mindset also restores something many men quietly miss: self-respect. Respect for the body they live in now, not the one they used to have. That respect translates into better care, better boundaries, and better outcomes across sexual and emotional health. Once a man understands this final piece, that aging is not an ending but a recalibration, everything we've discussed comes together, and that brings us to the most important question of all. What happens when you apply all of this consistently, with patience and without fear? That is what I want to leave you with in the closing message. Final message. If you take one thing away from this conversation, let it be this. You are not broken, and your body is not failing you. What it has been doing quietly and patiently is asking for a different kind of attention than it needed when you were younger. Aging does not erase vitality, it simply changes the rules by which vitality is maintained, and once you understand those rules, everything feels less frightening and far more manageable. For many men over 60, the greatest damage does not come from a medical condition. It comes from repetition without awareness, from doing what once worked without realizing the body has evolved. These mistakes we've discussed are not signs of weakness or poor judgment. They are the result of silence, lack of education, and the understandable assumption that no news meant no problem. Now you know better, and knowledge, when applied gently and consistently, is powerful. I want you to hear this clearly. Your sexual health is not separate from your overall well-being. It affects your confidence, your mood, your sleep, and the way you move through the world. When masturbation is done with care, intention, and respect for how your body functions today, it can support circulation, calm the nervous system, and reinforce a sense of dignity that many men fear they've lost with age. That dignity matters. It shapes how you see yourself. There is no need for shame here. None of these topics make you less of a man. In fact, choosing to learn and adapt at this stage of life is a quiet form of strength. It shows self-respect, it shows responsibility, and it shows that you are still invested in your quality of life, not just the length of it. Change does not need to be dramatic to be effective. Small adjustments practiced consistently create momentum. Gentler touch, better positioning, slower pacing, awareness of your muscles, respect for recovery, emotional presence, and a healthier mindset about aging. Each of these sends a clear signal to your nervous system that it is safe, supported, and valued. That signal alone improves function more than most men expect. If you've noticed changes, less sensitivity, weaker erections, less satisfaction, don't assume the chapter is closing. In many cases, it has simply been written in a language your body no longer speaks. Learn the new one. Give yourself patience. Improvement after 60 is often quieter, but it is real. And remember this, the men who do best as they age are not the ones who try to hold on to the past. They are the ones who stay curious, attentive, and kind to their bodies in the present. Your body is still communicating with you. When you listen, it responds. If this message resonated with you, carry it forward. Apply it calmly, observe honestly, and allow yourself to be encouraged by small signs of progress. They add up. Your later years are not about decline. They are about refinement.
And the choices you make now will shape how strong, confident, and connected you feel moving forward. As we bring this conversation to a close, I want to leave you with the most important lesson for men in their later years. Aging does not mean you stop caring for your body. It means you care for it more wisely. The habits that once felt harmless can have very different effects after 60, not because you are weaker, but because your body now responds to precision instead of force. Awareness, patience, and respect are no longer optional. They are essential. For older men, the real danger is not sexuality itself, but silence and routine. Doing things automatically without listening to feedback from your body slowly creates problems that feel sudden later on. When you pay attention, adjust your approach, and treat your body as something still capable of learning and responding, you protect not only your sexual health, but your confidence and emotional balance as well. The lesson is simple but powerful. Slow down, be intentional, and stop judging yourself harshly for natural changes. Pleasure, connection, and vitality do not disappear with age. They evolve. When you work with your body instead of against it, you give yourself the best chance to remain strong, confident, and fulfilled in this stage of life. If this message helped you understand your body better, I encourage you to support this channel. Please take a moment to like this video so it can reach other men who may need this guidance but don't know where to look. Share it with a friend, a brother, or anyone you care about who's navigating aging quietly. Leave a comment below and let me know which insight stood out to you. Your experience may help another man feel less alone. And if you believe in education that protects dignity and health for older men, consider donating to support this work. Your support allows us to continue creating clear, respectful, and medically grounded content for men at every stage of life. Thank you for being here and taking your health seriously.